Hello Sally, I'll be your trainer for today. My name is Shanna and we'll be going through a particular skill that is fantastic for a lot of different procedures. More specifically, it's used every day in beauty therapy and body piercings, which is really exciting. Today I'll be showing you how to assemble all required items before a treatment or procedure. So the most important thing to start with is just talking about what the structure is going to be today. First, I will show you how to set up in real time, and then I'll demonstrate and explain as I go. Then you'll have a go and see how long you take to do that. Alright, might ask you a few questions at the end as well. Okay, so alright, let's get excited and learn how to set up. So the first thing we need to do is clean our tray down with soap and water. Alright, then from here you can use your gloves wearing that just to use the soap and water with that if you need to. Then we're going to put down our thing here. So this. Okay, so I'm just going to take everything back off and explain to you exactly why I set this up the way that I have. Okay, so to break down the procedure more specifically, first I just pretended that I cleaned down the surface there and put down the dental paper. You can also use lint-free paper towel as well as cling wrap as well. After that, we actually need to wash our hands thoroughly and then glove up, getting ready to actually touch the sterilised items. Okay. So at that point in time, when you're putting on your gloves and you've just washed your hands, if it's particularly difficult, you can use a bit of towel powder. Alright. So from here, we've got specific sterilised items that we need to put down first, mainly because we need to keep the sterile field together. Alright. And at this time, this is when your hands are probably the most clean as well. So as I put these down, I'm checking the dates when they've been sterilised and making sure that there's no holes in the packaging, because if there is, then it means these tools may potentially be contaminated. Now, when I talk about contaminated, I mean more specifically cross-contamination, which means a bacteria or microorganism can unintentionally transfer from one object to another. So part of our job is to make sure that we avoid that completely and using the aseptic method, which is what I'll explain a little bit later. That's how we can avoid making sure that we don't have anything cross-contaminated with bacteria. Alright. Just another safety point here, we need to make sure that when we're putting down the needle, that we just keep it pointing away from ourselves as much as we can. Even though it's encasing, we just like to be safe. Alright. So now I'm going to put down the implements that are technically part of an unsterile field, which is your kitty dish and a micropen and some alcohol swabs and even a toothpick as well. Alright. Now all of these items are written in your items list, which is in your booklet that I've got prepared for you. Alright. So the item list is back further in the booklet if you did want to check all the items that you need for setting up. Okay. Now this method here, as I mentioned before, is using the aseptic method, which means that we are trying to avoid the bacteria and microorganisms rather than actively kill them. So basically what you see here is what we're doing. We're trying to keep this imaginary line through here, your sterile site and your sterile field, and on the other side here, you've got your unsterile film, basically. And that's just, in simple terms, talking about keeping those and avoiding the germs and bacteria. Right? Once you finish setting up like this, from here, you take your gloves off, and you just pop them inside out within each other to avoid, again, cross-contamination. Okay. This just goes in the bin. Beautiful. So now what we're going to do is I'm going to take everything back off and I'm going to let you have a go and see what you think. Yes. Well, you do have to clean the surface first, technically, and then put your paper down before you put your sterile gloves on. Right. So do that first. We're just going to pretend that we're cleaning it. Yep. Lovely. Then we're going to put the paper down. Yep. And now this is the point where you wash your hands and put the gloves on. And we'll put the gloves on. Yes, nice.
How many times have you put a hole in one of these gloves?
So many times.
It's always when you need to be quick.
Yeah. So true. Right. Okay.
So I want to put my sterile stuff down first.
Yes.
Checking for the date and if there's any holes in them.
Yes. Okay. So your needle's got to go first. Well, that's all right though. That's okay.
Should I take that off?
No, that's all right. I think generally, as long as you, the more you do it, the easier it gets. And you know, this is, for example, just trying to learn the basic knowledge, and you know, if this is the first time you've done it, it's hard to get it perfect straight away. All right. But no, I think you did well. All right. So from this point, you take your gloves off. Lovely. So, how do you think you went?
Yeah, my brain's not clicked on.
Yeah, that's
But,
okay.
like you say, the more you do it, the better you be.
Yeah, beautiful. So I'm just going to recap a little bit about what we've done. Again, the reason why we're doing this and assembling all your items before a treatment procedure is so you can adhere to the aseptic method, which is not having to touch anything, bacteria on your gloves or your hands, or having to leave the room, things like that as well. You know, so your aseptic method is very important, and like I said, what we are doing is avoiding the bacteria rather than killing it. Okay, and by doing that, it's making sure that we're avoiding cross-contamination, which is when bacteria such as HIV and AIDS and staph infections can hurt people. So that's the kind of dangerous bacteria that we're trying to avoid in this particular method, especially during body piercing. Alright? So what do you think is one of the most important points that you've learned from today?
That piercing isn't necessarily easy as what people think, and especially if they're doing it at home. Think twice before penetrating someone's skin without learning the safety
And everything, yeah, of course. Because they may not necessarily be aseptic in their house or their property. You know, they could have bugs everywhere. Absolutely. So I think you have done quite well. Obviously, if this is the first time that you're setting up and things like that, you know, putting the wrong thing down first, there's no biggie. But the more you do it, the better it's going to get and the easier it's going to get. Alright.
But if I did that with a client, that be a bit of a deal, or
I think, you know, even though the kidney dish is technically part of your unsterile film, we do generally clean them before we put them down here. So you're generally safe. It's just a good thing to keep in the back of your mind to do your unsterile things first. Yeah, basically. Alright. So do you think, did you have any feedback from the training session today?
no, I just want to keep moving forward. Yeah. I'm looking forward to moving forward.
Yeah, no, that sounds good. So from this point, when you do move forward and continue with your maintain infection control and assembling your things for your trolley and your piercings, from that point, a great continuation is learning how to clean everything afterwards, how to sterilise your tools, how to do a few other things once your procedure's finished. Another thing you can also do is how to prepare your client for a body piercing or a procedure, which is other things like making sure their skin's clean and a few other bits and pieces.
So technically I've got 100 more things to learn before penetrating the skin.
Yes, yeah. There is quite a lot to learn beforehand, but as we all know, there are important things to make sure that piercings go safely. All right.
Mm-hmm.
Okay, well, fantastic. Thank you very much for being in our training session today.
Thank
All
you.
right.
Yes.
Thank you. Look forward to seeing you soon.
Thank you.
Cheers.